I'm Dr. Bill. Thanks for taking the time to watch these videos about your wisdom tooth extractions. First of all, you're probably asking, do I need to get my teeth out? For most everybody in the United States, the answer to that is yes. The reason that we do this, and we do it at a younger age, is there's a risk of infection, risk of pain, and risk of impacting the important teeth that are just in front of those teeth. We call them the second molars. If we don't get your teeth out at a younger age, we often have to do it at a later age, and when we do that, the risk of complications goes up. What are the possible complications that could happen from having your wisdom teeth taken out? Well, the upper wisdom teeth are near the sinus. In extremely rare circumstances, when we take them out, the tooth could get displaced into the sinus. If this happens, we get them out and we move on and everything heals. It's extremely rare that this happens, but it's something that we need to tell you about. On the lower, one of the things that we are concerned about and why we took the 3D x-ray is to make sure that the tooth isn't in intimate contact with the nerve that runs through your jaw. That's what gives your lip and your chin feeling. In some cases, which is again rare, we find that the patients will be numb for up to 3 months after the procedure. In extremely rare circumstances, it can be permanent. The younger that you are when you get your teeth out, the less likely that this will happen. Again, these are exceedingly rare, but something that we need to tell you about. If you have any questions, feel free to ask us. You're going to be sedated for this process. Makes it more comfortable for you throughout the procedure. You're going to have a cocktail of drugs that we're going to give you that's going to send you off to a beach or the mountains, whichever you choose. And when you wake up, we're going to be done. It's important that you let us know if you or any family members have ever had any complications with anesthesia, and that you help us by filling out a complete medical history so that we know everything that's going on. Either myself or our CRNA Vicky will sedate you for the procedure, and we'll make sure that you're comfortable throughout the entire thing. This is a moderate sedation, so you'll be breathing on your own. It's not like general anesthesia at the hospital, and it's extremely safe. The next thing to talk about is your recovery. How bad is it going to hurt and how long is it going to hurt? This varies with every patient, but again, the younger you are, the better it's probably going to be, and the more erupted that your teeth are, the better it's probably going to be. Whenever we talk about recovery, we usually tell folks to expect about a week before they start to feel completely normal, and then typically 2 or 3 days right after surgery are when it's going to be the worst. Often we do these procedures on Thursday. Friday, you're probably going to want to just hang around the house and relax, eat soft foods. And by Monday, you're typically able to go back to work or school, still feeling some discomfort, maybe a little swelling still, but on the whole, you're doing much better. You'll take a combination of Tylenol and Advil, which you'll take approximately every 6 hours, that will help with the pain. Studies show that this is stronger than taking Vicodin, and it doesn't have any of the nasty side effects that the narcotics have. You'll also receive some drugs through the IV that help you in the immediate time after the surgery. All in all, your recovery should last about a week's time, and you'll be feeling better after that. Swelling is normal. Ice can help with this, as well as heat after the first few days. If you have any major concerns, please call our office and you'll get an extensive pamphlet that shows all of the recovery that you'll need after surgery, and we'll go over all this with your driver. While I'm talking about that, it's wildly important that you have a driver because you're going to be sedated and unable to operate a car. And then also it's extremely important that you don't have anything to eat or drink the morning of the procedure. We'll go over all this again when we call you for the pre-op instructions. We wanted to make sure that you covered it. We look forward to helping you with your wisdom tooth journey and look forward to seeing you in the office soon. Thanks a lot, and make sure you sign the form at the bottom.